Do I hear a motion to go into exec?
So moved.
I'll second. All those in favor of exec, say aye.
Aye.
Opposed? All right, why don't we start, since Henry Lippman isn't going to be here until 9:30, why don't we start with 131? But before we start, I might have to recess at 10 o'clock if we're not done, because I have a high school that's performing at the general council's, so I want to be there for them. So why don't we start with Senate Bill 131, relative to healthcare provider contract standards.
I move re-refer.
Do I hear a second? All right. Senator Whitley, would you like to talk to your motion, or?
I have heard from the parties that, you know, they need a little more time, and I think the re-refer would give them an opportunity to do that.
Okay. Any other discussion? All those in favor of re-refer, say aye.
Aye.
Opposed?
Consent.
Second.
Okay. Did you get that, Cam? All right. Any discussion on consent? All those in favor of consent, say aye.
Aye.
Opposed? And Senator Whitley, you want to take this out?
Sure.
Oops. 170. There is an amendment for 170, and I think I have spoken with some of you about this. I guess we need to make a motion first.
I move out to pass on the underlying bill.
All right, and I will second. And I have amendment 0674S, which basically right now, it just grandfathers the organizations, the daycare providers that are already able to take siblings. It grandfathers them in. This will take effect, 170 will take effect, but anyone who got licensed prior to that will be grandfathered in. There will be some additional legislation. I talked with HHS to allow it in the future to allow them to continue taking siblings. So, any discussion?
Madam
I'll
Chair, do you
second the
need a
amendment.
second? Okay.
Okay. Move on the amendment.
So the amendment's been moved and seconded.
Okay. All those in favor of amendment 0674S, say aye.
Aye.
Opposed?
Move on to pass as amended.
Second.
Any discussion? All those in favor of ought to pass as amended on Senate Bill 170, say aye.
Aye.
Opposed? Do we want consent?
Yep. Move consent. Second.
Okay. All those in favor of consent, say aye.
Aye.
Opposed? And
I can take it up.
I'll take it out. Yeah, I'll take it out. Kim, we're gonna have to get together. I'm not gonna have time to write this all down. Marie's gonna kill me if I don't have all this written down. All right. Once. Yep.
Second.
Okay. You may.
Can you turn your microphone on?
My microphone on, thank you. Lack of caffeine, I'm working on it. I've been, have positive discussions with the carriers and we are moving forward, but more importantly, I have talked to the insurance department and asked for an insurance mandate review. We really need to button that up before we can move forward, so I do need more time to make sure that we have this exactly the way it needs to be before we bring it back to this body and back to this group hopefully over to the Senate floor and to the House. So that's my plan.
Okay. Any other discussion? Seeing none. All, huh? Oh, okay. All those in favor of re-refer, say aye.
Aye.
Opposed?
Consent?
Second.
All those in favor of consent, say aye.
Aye.
Opposed? Senator Prentice, you
I'll
want to take that out?
Absolutely.
Okay.
Thank you.
Senate Bill 235.
I move ought to pass on the underlying bill.
Okay. Is there a second?
I'll second it.
Okay. There is also an amendment 0686. And basically what this does is, it doesn't mandate that primary care physicians need to use the behavioral health model, but if they choose to, it will be covered. The insurance coverage will cover it. So what I didn't want to happen is us mandate to the primary care physicians that they had to have a behavioral model if they didn't feel comfortable with it. So this allows them the option basically to opt out or opt in, whichever they
Do you want
prefer.
me to move the amendment?
Second.
Okay.
Good compromise. Thank you.
All those in favor of amendment 0686S, say aye.
Aye.
Opposed?
Move on
And
to pass as amended?
Second.
any other discussion? All those in favor of Senate Bill 235, say aye.
Aye.
Opposed?
Consent?
Second.
All those in favor of consent, say aye.
Aye.
Opposed? All right. Senator Prentice, you want to take this on? Okay. Moving right along.
And we're trying to get you out of here by 10, Senator.
Senate Bill 237.
Move on to pass.
Second.
Senator Whitley, you had an amendment?
Yes, I move amendment 0239, and we'll just speak very quickly to the amendment. It does three things. It revises the appropriation in line with the DHH request, which is 14 million each year of the biennium. We did receive some information from both the department and others that that number could be addressed, but I think that's probably something that the finance committee could really look at based on the governor's request. So that's the first thing it does. Second thing it does is it's a drafting error. It eliminates language that was already in SB 175. And then there is a minor change on page 1, line 18, just sort of cleaning up some language. And that's it.
Senator Bradley.
So I want to ask Senator Whitley a question,
Yes.
probably several. I spent a lot of time looking at this amendment, and my concern is that the bill is introduced, had a price tag of $18 million. The amendment has a price tag of $31 million, which I think as it works its way through the process is problematic. I would note that the bill is introduced, funded the program that's being created, the Workforce Fund, RSA 126A, and did not fund the programs that support, parental scholarships. And you changed that to defund the Workforce Fund, but actually fund the other, which I think is a good change on your part, and I support that. But what I would hope you would do is agree with me in the amendment, and I haven't had a chance to talk to anybody else about this, on line 20, instead of,
First page.
in the amendment, line 20,
What page?
page 3, I'm sorry.
Okay.
We're talking appropriations, I apologize. Instead of where we had, I think I had come to the point that I could support, at least initially, the appropriation that you had outlined, although in the different part of the bill, I would ask that you change your amendment on line 20 to say 7 million and 7 million. I know that that's probably not what you would like to do, but I think given all the pressures that we're going to face in the budget from numerous initiatives that people have asked to fund housing, education adequacy, water, PFAS, childcare, the list goes on, that would be a reasonable compromise and in line with your original filed bill. So I hope that you would agree with me to do that. The rest of the amendment, as long as the bottom line price tag remains the same, I'm okay with. I mean, you did delete,
Good commission or?
you deleted the $500,000 appropriation
Right.
in the amendment. So,
Yeah, if I
but
may.
other than that, everything else remains the same. So I hope you can agree with that. And I
So-
hope my colleagues on this side of me can agree with that. I find myself now in a different position being in the,
No, I like that.
here we are.
So thank you for that, Senator. Just wanted to clarify the amendment. So if you look at page 3, the first appropriation is for the workforce fund. This is something that we saw last year in 246. I don't remember the number, but anyway, we funded it for $1 and $1, and that is because there is money working through the Gopher process towards this same goal. And so we don't know how much Gopher has approved yet. And so the reason why we put it at $1 for each year is to see what they get from Gopher, essentially. So we need to create the fund as a policy priority and then see what comes through from Gopher. And I think finance is better equipped to see what is appropriate for that line item. It was a drafting error that about the appropriation, so it wasn't sort of a defund fund thing. I will say, I'll go back to the third appropriation for the child care scholarship changes. The appropriation, the fourth appropriation for the community college system, that's potentially something that is already in the governor's budget. So we need to confirm that. Maybe Katie can help us with that. So again, that could be a fiscal, something that the finance committee could do. So that could lower the price tag. And then going back to the child care scholarship, your request was to go to 14 million a year to $7 million a year. And I think at this point I can support that because we know that the department reevaluated their assessment of the need, and it was more like 12 million. And we also know that the governor put some money in his budget, so that could bring down the 14 million number. And then furthermore, there are some additional federal dollars. So what I'm sort of thinking about is, does it need to be $7 or $8 million a year? But I think if the committee is comfortable with 7, let's let the finance committee really dig into those numbers. And potentially, we may not need the appropriation in 4. And so I think at this point, let's get it out of the committee on the policy and then let the finance committee deal with that.
So if that were the case, there would need to be a committee amendment that would change.
You already got it? He's already got it.
Yeah, so the committee amendment, which the only thing it would do was would be changed in on line 20, the two $14 million appropriations to
million.
7.
Okay.
And then I would just ask, I know, there are 2 members of the finance committee here. There is another estimation out there. I know that the parties have come together and put together a memo about that. And so I would ask the finance committee to, not just hard and fast at 7, just really look at what's necessary based on inflation and everything else. So that would be my only request of the 2 committee members.
Okay. So,
I'll second the committee amendment.
okay. Senator Whitley moves it. Senator Avard seconds. All those in favor of Committee Amendment 0239S, say aye.
I
With the change to 7 million and 7 million.
Correct.
Aye.
All those opposed, say aye. All right. Do we want it on consent?
We want to pass
No.
the bill as
Ought to
it is.
pass as amended.
Oh, I'm
I
sorry.
move out to pass as amended.
All right. All those in favor of ought to pass as amended, say aye.
Aye.
Opposed?
I think this should not go on.
Yeah, I agree.
Okay. Bree wants to know if you're writing all of this stuff down on your folder. I told you.
Well, someone's gonna get in trouble.
Who is going to take out
Someone
Senate?
is gonna get in trouble.
Senator Whitley.
I wouldn't want to cross Marie.
He's some crow.
I don't even have my folders.
I'm not telling her that.
No, I do. I have them here, but
Okay, Senate Bill 239 relative to the use of harm reduction. We do have an amendment. I talked with Senator Waters this morning. 239. Okay. So, has anybody had a chance to review the amendment? He did make the changes that we had talked about, saying federal money would be funding this. And I think he said he had HHS review it. They are okay with it. So does anyone have any question? Well, first of all, I guess we need a motion to, ought to pass on 239
So moved.
first. Okay. Correct.
Second. Oh, good.
Okay, we're all, all right.
Did we move the amendment?
Do we want to move the amendment?
I'll move it.
I want to make one change in the amendment.
Where?
I think if you look at the bill on page 4 and compare it on page 4 to the amendment, section 12, in the syringe service programs, I think we should go back to the original language.
Well,
Consult and inform municipal law enforcement agencies concerning syringe service program harm and reduction activities. I think that should remain in the bill.
Senator, can you say that again?
Line 13.
it was line 13, page 4, on the original bill. It's section 12, under syringe service programs. It says consult and inform municipal law enforcement agencies concerning syringe service program and harm reductions. Senator Waters has taken that out of that section. Senator Bradley would like that back in.
I'll second that.
Yep.
I'm in favor of this. When they talk about activities, it's just merely making sure that when these services are in place in municipality, that local law enforcement is aware.
Yeah, I think so.
Consult and inform municipal law enforcement. It's just informing them so that they're, my interpretation would be so that they're aware.
That is mine.
All right, so I think where it should go, is in the amendment, a new section C on, it would become line 13. So it would be after
Oh,
line 10, coordinate and collaborate. It would be after that section, and then there'd be a C, consult and inform municipal law enforcement agencies, the language in the bill. Okay?
you got that? Of course he does. All right. Any other discussion on amendment 0813S? All right, do I have you already moved it, right? Is there a second?
Second, with the committee amendment.
All those in favor of 0813S with the addition of the consulting the law enforcement, say aye.
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 Opposed?
Move on to pass as amended?
Second.
Any other discussion? All those in favor of ought to pass as amended on Senate Bill 239, say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent, say aye.
Aye.
Opposed?
Thank you.
Senator Abar, would you take us out?
Sure.
Okay, moving right along. Senate Bill 241.
I'll move on to pass.
I'll second.
And I will move that we
Amendment.
adopt Amendment 672.
Any discussion on 672?
Do you need to second that?
So just to clarify, I think the language in the original bill was redundant because the department had already spent extensive work studying the cliff effect. So my understanding of this amendment is that we're requiring
Them to continue.
just to continue that work to do, I mean, they've already issued a report, and so we say continuation, but do we want to have them issue another report? I don't know what's more appropriate.
Does HHS have a thought on that one?
On the amendment or the bill?
Amendment.
Good morning, Karen Hebert, Department of Health and Human Services. Could you repeat the question? I apologize.
Thank you. I appreciate you coming up to clarify for us. So the original bill, when we heard testimony, was that, you know, it was an important concept, but that the department had been studying it extensively through the cliff effect report. And my understanding is that you've already issued a cliff effect report. And so what the amendment does is asking the department or requiring the department to seek a continuation of that analysis. And so I'm wondering if instead of a continuation, is it continued work or are, you know,
The department ended up implementing the recommendations out of the original report, which was released in 21. So what this would do essentially would be study the effect of those particular initiatives that we have implemented. Some of them are pilots, so it would be helpful to see the results of that to be able to report out on whether they were of value or not. Yep.
that's helpful. Thank you.
Okay. Any other questions? Thank you.
Thank you.
Where are we?
So Senator Bradley moved and Senator Avard seconded Amendment 0672S.
All right. Any other discussion? All those in favor of Amendment 0672S, say aye.
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 Opposed?
Move on to pass as amended?
Second.
Any discussion? All those in favor of 241 ought to pass as amended, say aye.
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 Aye. Opposed?
Consent?
Second.
All those in favor of consent, say aye.
Aye.
And I'll take this out. Two 42.
Second. And I have an amendment. I'll move amendment 0643 and speak to my amendment.
Sure.
So, there was conversation in the hearing about making sure that parents were fully informed if this process was put into place. And so this amendment is an attempt to just be very clear to school districts that if a family or a child is identified through Medicaid direct certification, that they are given the option to opt out. So, that retains the, parental choice and notification, and I think that it's a good statement to add to the bill.
Amendment.
Okay. All those in favor of amendment, who ought to pass it?
Senator Whitley moved the amendment. Senator Avard seconded the amendment.
Okay. All those in favor of ought to pass on 0643, say aye.
Aye.
Opposed?
I move ought to pass as amended.
Second that, if I could speak.
Sure.
So I think everybody on this committee wants to make sure that any child has access to the free and reduced lunch program. On its face, it makes all the sense in the world. Unfortunately, the testimony that we've heard, because of the pandemic, a lot of parents stopped filling out the surveys that were required to enroll their kids in free and reduced lunch. Obviously, that's a problem, although it didn't diminish the opportunity, it had the impact of potentially disenfranchising some kids. My understanding is that by moving to direct certification, some 6,000 to 7,000 students would be eligible for free and reduced lunch, and that's a good thing. The question that the Finance Committee is going to have is, what does that do to education adequacy? And I think that in conversations that I've had with the Department of Education, it would be a floor cost of about $22 million. Similar to what I said about your bill on childcare and all of the other funding initiatives that we're going to have to deal with. And how could I forget, with Senator Rosenwald in the room, your favorite subject, Medicaid rates. I'm willing to support this at this point in time. I think that it will have to be part of the overall discussion on adequacy and where we end up going with that. The formula for adequacy is being proposed to be pretty dramatically changed in the governor's budget proposal. I think, people are going to want to look at that very, very carefully. I'm one of the few people here that has endured spreadsheet wars going back to 1999. Let me tell you, it ain't pretty. And we'll see exactly that kind of debate. So happy to support it on principle today, but the 22 million, and it could be as high as $30 million cost from what the department has said, is a potential stumbling block. And I want to make sure that everybody sitting in this room, the advocates for it, understand that. It has really nothing to do with direct certification. It's really more how we use free and reduced lunch as a funding mechanism for adequacy. So with that, I'll stop and thank you very much, Madam Chair.
Where are we?
Madam Chair?
Yep.
If I may ask, I agree that it sounds like, based on some pretty, detailed analysis, that we are talking about 6,000 to 7,000 children. So I don't know if you have heard from the DOE how they got from 6,000 to 7,000 children to 20 to 30 million dollars in adequacy. Like, knowing even with the increased pupil per student, take 7,000 children, that doesn't get us to 30 million. And so that's sort of my disconnect. I haven't heard a basis for the Department of Ed's calculation of 30 million. We have our calculator.
So, I mean, if you take I think the adequacy right now, I'm sorry,
Yep.
is $1,900 for free and reduced lunch.
Mhm.
That would be 13.3 at 13
Mhm.
at 7,000 kids.
Mhm.
The governor proposed to move it to 2,500.
Mhm.
That gets you to 17,500.
Mhm.
So, there may be some fluidity in the numbers. It's still a pretty big price tag. The estimate that I had in a conversation with people from the Department of Education was a threshold of probably 22 million. So it's somewhere in that, ballpark, certainly.
So, thank you for that. The other thing that we want to look at too is what the governor has put in the budget for Medicaid direct certification. I have not confirmed that it's an HB
I
2.
think it is, the funding for it, my understanding, is an HB1 without the authorization.
Okay.
So again, it's something that, as we discuss Medicaid, childcare, housing, water, PFAS, and all of the other things that we're gonna have to fund.
Do we know what the number is in the governor's
I
budget?
don't.
And this is a discussion we'll have when we're in finance too.
Great.
So,
We know that you monitor finance
I
carefully.
do.
someone else does too, by the way. So, all right, where are we? Ought to pass.
Senator Whitley moved and Senator Bradley seconded ought to pass as amended.
Okay, so all those in favor of ought to pass as amended on Senate Bill 242, say aye.
Aye.
Oppose? And I'm not gonna put this one on consent.
Yeah, no, that's a good idea.
I can take it out.
Oh, Senator Whitley, I'm sorry.
And I won't leave the building.
Okay, you got that.
Oh, today. Okay. All right.
Why don't we finish, see Henry's here, so why don't we just finish with, the rest of these and then we can move on to 36 and 86. So, do I hear an, ITL motion on 265?
So moved.
Second?
I'll second.
Okay.
So if I can speak to that.
Yep.
So in looking at the documentation that we were given about MTSS, seems to make an awful lot of sense as a initiative. As I look at the fiscal note, these programs are already occurring, and it appears to me that the appropriation is really more than anything else about creating the 9 positions at the Department of Education. If the motion prevails, my recommendation to the supporters of this is to come back in a year with a grant proposal as opposed to having the Department of Education with 9 new positions and use that money to try to buttress what schools are already doing. I think that is a much better approach at this point than what's outlined in the bill.
Sure.
So my concern with that approach is that our system for children's mental health is very, very fragile right now. We have kids piling up in ERs because they are not getting what they need. And we just saw a very troubling report from the New Hampshire Women's Foundation that the impact on girls in particular is dramatic. So it's girls who are reaching this crisis level. And the work that's happening in the school district, supported by the Department of Education, is really the bare minimum of what we should be doing. It's invaluable to prevent children from reaching a crisis, right? I think we have an obligation to support that work. You know, on the DHHS side of the system of care, we followed the very careful process of getting federal dollars and, you know, making sure that those were leveraged and making sure that we had the outcomes we wanted before we spent general fund dollars. We just haven't done that on the education side of the mental health crisis. And this was sort of the bare minimum to do that. What might happen if the Department of Ed doesn't have this funding is that they will lose the 9 positions dedicated to supporting schools to do this work. And that's my biggest concern.
Well, the one thing that if you look at the fiscal note, it says here, the department states by funding these activities with state funds, it would no longer be able to seek federal funding opportunities. So by putting it onto the state, we're not going to be able to fund it with federal dollars based on the fiscal note.
I don't know where that came from because that number for 1 million actually came from the department. That's what they would need to continue to do that work. So and maybe there was some miscommunication within the department, but I arrived at that number based on what they would need to continue. Now the department is gonna, I'm sure, continue to seek that federal funding, but they can't leverage that without internal capacity to do it. That's my only concern. I mean, the Office of Student Wellness might as well, it's gonna be gutted without support when these federal funds end.
So if I recall, Madam Chair, during testimony that we had asked if the Commissioner of Ed was apprised of this, and in the affirmative, he was not. And I asked him directly, personally, and he said that he would not support this.
Well, I don't know. I had many meetings with the commissioner, and Melissa White from the department was here and she supported the bill. So maybe Melissa White under the commissioner is not talking to the commissioner, but that number was directly from the Department of Education, and I met with the commissioner himself on this.
I did too, and
Yeah.
he said he wouldn't support this. Flat out, I asked him personally because that was a concern of mine, and he said he would not support this, had he known about it.
But
Well, then there's some miscommunication because
Yeah.
his deputy
Yeah.
helped me write the bill.
Well, thank you very much for that, but I'm just going by what he said, and I asked him point blank.
Yeah.
And
So he's lying to one of us,
And-
unfortunately.
no, I don't know if there's a lying, nobody's accusing anybody of lying, but I do believe that it's not supported. I don't support it either, because to me, it's adding an extra layer of bureaucracy to our school system, and I don't support that.
in an
I
area,
understand-
in an area where it's already happening without the additional $2 million per year. We have 37 school districts that are already using the MTSS, and there's nothing stopping the school districts from implementing it as well.
Well, no, I mean, I respectfully disagree. They won't be able to do it without the support of the Department of Education. They have coaches for ongoing fidelity.
Senator Birdzell, I just want to add that there are schools that are already using this, and the only way to grow this program productively so that it does the work that needs to be done is by moving, this policy document. My opinion. So,
Okay. So, we have-
Senator Avard moved and Senator Bradley seconded ITL.
are we still on board with that? All right. Any other discussion? All those in favor of an expedient to legislate, say aye.
Aye.
Aye. Opposed?
No?
And I will take that out. Yeah.
I'll support you.
Thank you. All right. Okay, why don't we move on to Senate Bill 36? Or do we want to do 86 since Senator Rosenwald's here?
Sure.
We'll do 86.
Move. Ought to pass.
Second.
All right, and Senator Bradley, you have an amendment?
I do. It's Amendment 732.
I'll second it.
So Senate Bill 86, as introduced for Medicaid rates, called for $145 million Medicaid rate increase without real specification as to which Medicaid providers should get what in terms of differing amounts. When the governor introduced his budget, he proposed a 3% and 3% Medicaid rate increase across the board in 24 and 25. That's very similar to what Senator Rosenwald and I, you sponsored, I co-sponsored in 2019 that became part of the budget. That obviously was helpful then. I think this committee over the last couple of years, and certainly this year, has heard pretty compelling testimony from a wide range of providers about the need for enhanced Medicaid rates, whether it's to provide for seniors in nursing homes, families with disabled children, the CFI program, any community mental health centers, a whole range of our public health system is in need of, in my opinion, Medicaid rate increases. That being said, this is the third or fourth time on the broken record. The budget has to be put together in a way that works overall. So my amendment, what it does is it takes the $145 million and splits it into 40 million in each year. So it is a reduction, but it's something I think that, given the overall budget picture, that we will be able to do, and we should seek to do it. I eliminate the funding for the other pieces of the bill after that, because I think the priority has to be Medicaid rate increases. So I think Senator Rosenwald, starting in the bill on page 6, the area health education centers, there was an appropriation for $9.5 million, $2 million for a training program, community health workers. Those appropriations, I would propose in this amendment that we eliminate and focus strictly on the Medicaid rate increases. In the amendment, and working with the department, who's here now, Section 3 is meant to replace the balance of the bill that I just spoke about with the OPLC certification of community health workers, and then lastly, the Department of Health and Human Services would have to submit a report on how that health education centers training programs are working. So I think this is a rational approach. I think it does what we need to do. It's affordable, and I hope that we can support it.
Senator Press.
Thank you, Senator Britzel. Senator Bradley, can I ask you a question, really two questions?
Sure.
Okay, thank you. So in the governor's budget, it's a 3% increase, and there's also an increase for CFI. So the amount that you have in here, the 40 and 40, is it layered on top of that?
So if we were to adopt this amendment in the budget, my understanding is it would be a 6% Medicaid rate increase across the board. So CFI, nursing home, et cetera. Now, I suspect that by the time this bill gets to finance, which will be fairly shortly, hopefully, but more importantly, as the finance committee puts together the budget, and Senator Rosenwald's obviously a part of that, that if we choose to have percentages that are somewhat different, I mean, I note, for instance, that, the Hospital Association is, not testified for a rate increase on their behalf and would want to see it go to CFI and nursing homes because they have people they
need
can't
to move there.
discharge. And so those decisions, if there is going to be some differentiation, can be made later, okay? What I'm trying to do is sort of establish what I think is a rational floor of what we can afford. So my understanding is the 3%, figure is about, that the governor proposed about half of the 40 million. So in that 17 to $20 million range per year. So I think that given,
So, so it's an increase from what the governor put in.
yes, it would be
But not layered on top of.
not layered on top.
Okay.
If we adopt it the way it is. I'm sorry, it was a very long-winded answer. Thank you very much.
And your second question?
I'm not talking about Medicaid ever again.
Oh, come now.
Promises, promises. Your second question.
Well, actually, it was CFI and the Medicaid. They were those were the two.
Okay.
So
All right,
I
got it.
bundled it into one.
And
There we
as we get into talking about 36, the CFI rate increase that was called for in 36 is now in 86.
Okay, Senator Whitley.
So I certainly appreciate the necessity of having to balance, different funding requests. I think unfortunately, this amendment falls pretty well below what is really necessary. We hear almost desperation from our providers, and we're beyond crisis, and we're either going to pay, a little more now, or we're going to pay a ton more later. So I can't support the amendment. It doesn't even come close to, funding what is really necessary. I think finance will certainly have another opportunity to discuss it, but I think, this is not even close to what we need.
All right. Any other discussion? Where are we?
Amendment 0732S was moved by Senator Bradley and seconded by Senator Avard.
If there's no other discussion, all those in favor of amendment 0732S, say aye.
Aye.
Opposed?
No,
No.
Vote to pass as amended?
Second. All those in favor of Senate Bill 86 ought to pass as amended?
oh, might just say that, I am going to be supporting the bill, only because this is important policy. We're a policy committee, but I think, there needs to be a lot more work on this. And, I'm only going to support the bill because it's important policy. I certainly don't agree with the amendment reducing it dramatically, but I will be supporting the underlying bill.
Understood. Senator Prentice?
Thank you, Senator Britzel. And I'll be supporting the underlying bill as well. And at the risk of repeating what's been said, we heard throughout the testimony for 86 and what we know from even a recent, briefing from healthcare organizations. There's crisis upon crisis upon crisis. And so this is not just about I mean, the Medicaid rate increases impact the workforce side of this, but if we're not preparing our pipeline for the future, we're just gonna keep coming back here. So that's a great concern. All right, thank you.
All those in favor of ought to pass as amended on Senate Bill 86, say aye.
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 Opposed? And we probably should have put this on consent. I will.
Throw another platform.
Last bill, Senate Bill 36. And some
I
of
move
them-
on to pass on the underlying bill.
Take a break or?
No,
Sure.
do we think this is gonna take?
Yeah.
Okay, so why don't we, recess till, 10:30?
Thank you.
Don't forget to
Do you need to turn on your mic?
Not yet.
And I don't. So for discussion, I'll second it. Yes.
All right, we will be coming out of recess
Second Senator Whitley's motion to ought to pass.
on Senate Bill 36. And there is an amendment, Amendment 0673S. Do you want to speak to me?
Sure. Okay, so, I worked with the department on this amendment. I understand from, some of the conversations we've had during the half-hour break that, not everybody's really thrilled with it. So I will make a commitment to continuing to work with the department, to work with the advocates. Sometimes I find it better to just, cut out the middle person, that's us, and work together. So for all the folks that were interested in the system of care that was involved in 36, I want you to work with Henry, with John, who is the best person, both of them here, and Chris Santiello, Bob and Carolyn on the issues that you've raised, work with them. The bill will go to finance. You've got a couple of weeks. My sense is that it probably gets included in the budget, although that's not guaranteed. I can't speak for, what the full finance committee would want to do, but I think there's opportunities to continue to work on it. So let me just try to outline what the amendment does. The first change is the look back provision. It goes back to 36 months, but with the opportunity for 60 months. That was something I actually, when I was in Washington, voted for the 5-year look back. But I think this is a reasonable proposal on that score. So the second section, the whole concept that was in the bill with the system of care and the presumptive eligibility, it creates the amendment, a pilot program for enhanced opportunity to get into community-based care. Now, I know that the advocates don't think it goes far enough. That's where, in particular, I want you to work with the department, okay? Then sections 5 and 6 and 7. So those are changes in terms of, how the bill was proposed. It goes to more of a community-based resource center and counseling programs. As I said before, the market basket rate that was called for in 36 is part of 86, and the 6% rate increase that the $40 million represents in that bill that will go for CFI. One complaint that I heard from the advocates, and John and Henry take this back, if we're going to go with this, way of doing things that's in the amendment, they want the rate setting to be more transparent. I think that makes sense, okay? In how you determine, nursing home rates, CFI rates, et cetera, that makes sense.
Excuse me, Senator, is that in section 4?
Well, it really is. Yeah, it's on page 3, in the bill, Roman 4. But again, I think we would need to, as the bill works its way through the process, see more opportunity for agreement there. Section 9 in the amendment changes the disregard to a maximum of $3,500, and then lastly, in the amendment, the reporting. So I hope that all of you who are out here today understand, based on all the bills that this committee has had to deal with in a pretty short period of time, just this morning, that we haven't maybe gotten it as right as everybody would like, but we've worked incredibly hard on Senator Whitley's bill, on Momnibus, on childcare, on 86, on this bill, and all of the other bills that we've had today. This has been the most bills in HHS. Senator Birdsall has done a remarkable job as chair. Never having sat on this committee, thank you very much. You want to kill me for putting you there. But, just cut us a little slack. If you're not 100% happy with the outcome on 36, it's a work in progress, all right? And that's what I can tell you. So, thank you.
Senator Whitley.
So I'm wondering, if we want to consider not amending the bill. I mean, I think that you're very right that I think the parties need to sort of get together and figure out the priorities, but I'm concerned as a policy committee that we would be, because essentially the amendment, in my opinion, just sort of guts the bill in its entirety and takes away what I think the core intention of the bill is, to create that system of care. And many of this on this committee are aware of what a system of care looks like in children's mental health. I think this was an effort to make our older adult system more like a system of care. And so unfortunately the amendment it guts that. We're not creating a system of care. So I'm wondering if, because of, I heard the Senate President's commitment to getting this right, I'm wondering if I don't think I can support this amendment because it doesn't get where we need to be on the policy. So I'm wondering if we don't want to amend it, if we want to leave the bill as is, because I think we are understanding that, we heard really dramatic testimony, right? That older adults are dying, right? That we have to do something. This has been a neglected system for so long. And so, this committee might want to consider thinking through, on the policy perspective, retaining the system of care elements. So that's my proposal. No, so my proposal is passing it as is, not with the amendment. And then, of course, the finance committee is going to have to look at this on balance with the other priorities. So let them do that. But keep the core goal of this bill, which is to create a system of care. And I think the amendment kind of guts that. So that would be my proposal, to just pass the bill as is, retaining the system of care, and then let finance really, and then that would give because I think this amendment is sort of reflective of only one side of the equation here. And I think let's give all the parties an opportunity to come together, as Senate President said, without our interference. Let them come to the finance committee with something that they might feel comfortable working on. That way we could get this out, on a unanimous vote on supporting the idea of a system of care, and let the folks work on it some more.
I can appreciate what you're saying, but as 36 stands as is, I can't support it. There's just too much going on as far as in the bill, and I think we do need to, I like the changes that Senator Bradley put together in that amendment. Yes, maybe it needs to be worked on in finance, but finance is not going to be able to do the due diligence on the policy piece of it in finance. That's our role. And where Senator Bradley did a lot of the yeoman's work on this, I'm comfortable with the changes that he's made, with some minor changes that need to be made in the in finance. The other option is re-refer. And that pushes it out even further.
Go ahead.
Thank you. Just wanna- So actually, when Senator Bradley was opening with his comments on, talking about the amendment and talking about the original bill, I thought that's the direction we were moving in because, my experience has been that when we're asking the stakeholders to dig in even deeper to get this right to a place where we can pass it, that's the pathway. So, I mean, I think the policy pieces of this, we've spent a lot of time on this committee. Well, in a short period of time, we spent a lot of time talking about the necessity for systems of care. And without these systems of care, I just said the same thing about work, about Senate Bill 86. It's just going to be one crisis to another crisis to another crisis. We've got to fix where we're at so that we can keep this from happening in the future and build a system that is actually better for the communities, better for healthcare, and more efficient in terms of cost. And that's the place that we're at. So, and actually having an elderly mother and thinking about her in this context, living in my community, these are the kinds of services that will keep her in her home versus in a long-term care facility or going back to a hospital again and again and again. So I think we have an opportunity, as we have been viewing one by one, building support in our communities versus throwing everything on top of, like, say, hospitals. So, I mean, I would be open to, I know it's not the perfect solution, but rather than this amendment, I'd prefer to take this bill and hold on to it and actually expedite the process with the stakeholders to get this done. And I'd be committed to working with them if that would help. That's my 10 cents. Or maybe it's a
when-
quarter.
When you say, hold on to it, are you talking re-refer? Just keep in mind, the problem that we would have with re-refer is it wouldn't go into the budget and therefore it would have to go to the House.
Right. That's why I don't think re-refer is the right, like, path. I think you're right that we need to continue to get folks back at the table. But I guess what was confusing to me about the amendment is that the system of care provisions that were removed didn't have the fiscal impact. So as a policy committee, we could do a committee amendment, maybe returning a lot of the system of care provisions back in. That's another thought. Or we could do that as a floor amendment.
What are your thoughts, Senator Bradley?
Okay. So today's the 8th. It's on the floor on the 16th. Comes out of finance. We will probably do an addendum calendar so it can come back out of finance on the 28th. I'd prefer to go with this amendment today, with the understanding that the advocates would have a couple of weeks to work with the department and address the issues that even I, as a co-sponsor, saw, with, again, this goes back to the debate that we had on a prior bill involving the Department of Education, just huge increases in the funding for ServiceLink, for the ombudsman. Obviously, I was concerned with the market basket rate because it's out of, as I understand it at least, our budget purview if it's automatic to market basket rate. So that's why I took it upon myself to try to work with the department to move toward what the advocates want, which is a system of care through a pilot program. Obviously, there's some concern there, but just in the process that I outlined, everybody's in the room today. There's nobody better than John from bringing everybody together. You'll have your work cut out for you, but that's what I'd like to see. So it won't be on the floor until the 16th. And then there's still enough time before it, has to come out of finance to try to get it into shape. But if it is, my sense would be that it should be tabled and put in the budget, so there's more opportunity to continue that process. The other option that, Senator Prentice and Senator Birdsall talked about is re-refer. The funding for CFI is in 86. It should stay in 86 because it has to go into the budget. To me, that's probably the biggest thing, at least on a short-term basis, is the funding. I think, having worked with you and Feltz and others to create the children's system of care, it took a while. It wasn't like that. And this maybe was biting off a little bit more than we could chew in 3 months. Sorry, just a reality. But here we are. So that's what I'd propose, that I would hope we would pass the amendment, understanding that everybody has to work hard to take the 5 of us out of it for now and sit around the table, and when we see the white smoke, finance will say thank you.
So,
Somebody die?
so I can't support the amendment because it strips policy that I think is good. But I am committed. What I hear from you is that you're willing to consider a potential floor amendment if the parties get together in 2 weeks.
I think a floor amendment is difficult by next week, but I think when it comes to finance, there would be a little bit more opportunity. Now, I don't know. Maybe there's miracles that can happen in the week, but
There's,
when I met with the department, 3 separate times trying to come up with this amendment, and obviously we didn't.
and also,
Yep.
don't forget that if it's tabled, we also have, like Senator Bradley said, we have a chance at the budget, which gives us till almost May.
Honestly, I didn't think there would be the reaction that, because I think it is a process similar to, it took several years to create the system of care for children. Then the pandemic hit. Then the easy part was, in retrospect, passing the legislation. You and I remember the debates that we had in 2020 over Zoom about how long it was taking to get it implemented by the department because of the pandemic and the inability to hire. So it's not just waving a magic wand, nice as that would be.
Senator Prentice?
Just want to make sure procedurally I have this straight. So we're still talking about the amendment.
Correct.
But during that time period, if the, because this basically becomes the bill.
Yes.
Okay.
To replace.
So between now and the 16th, with the stakeholder groups taking, us to the side of this, they would be working on bringing pieces and parts, if not, all of this potentially back into this document, which would end up, it gets a visit at finance and it could be tabled, and kind of working in the, like, off of this and reaching back into this bucket. I'm just trying to get this straight.
I'm not sure it's gonna be when they start working on it, I'm not sure it's gonna return back to this full piece.
Okay, but it would return back to something like this that everybody could.
What I want to see is an agreement between the advocates and the department that's workable and can be implemented. And the reason I bring up the child system of care is the easy part in retrospect was passing legislation. The hard part is being able to implement it, especially when you have worker shortages, and that's exactly, everything that we've debated, in your bill on child care, in Senator Rosenwald's bill on 86, we're dealing with healthcare worker shortages. And so to think that, we can just pass a bill and implement it, it does need to have that step-by-step process. And having worked with John and Henry in all the times that I've worked with them on Medicaid expansion, and we're gonna vote on that tomorrow, it was a process. It takes time. You have to build, you know, the system from the ground up. I appreciate everything the advocates are saying. I co-sponsored the bill, but you also have to understand that it doesn't happen overnight. And the children's system of care took time, and here we are. When was that, 2019? And here we are in
No, it
2023?
was earlier, and
Well, yeah, the groundwork was done
Yeah,
earlier, and here we are several years later, and it's finally,
But what I was
doing
gonna
pretty
say
well.
is that I very much agree that it is an incremental process. And I think and just in terms of the children's mental health care, system, we actually created the system of care back in 2015. You all did. And that was just the structure, right? And then it was year upon year of sort of building and, layering. But that's why this amendment sort of takes out that first step. That's my concern.
I get that.
Yeah. So I think that's why I think when we go back to the table, we need to set up the skeleton structure that we did in 2015 for children's mental health. We need to set up that skeleton structure, and that's why the amendment just doesn't do that. We remove that skeleton structure upon which we can build. So I think we agree on that part.
Well, I think John and Henry have heard loud and clear the concerns addressed by the advocates, but also the concerns about, and I keep sounding like a broken record, how we put the budget together, addressing all of the things that need addressing: education, housing, water, Medicaid rates, childcare, and other things. It has to fit together. So I hope we can pass this amendment. I think the marching orders for the people in the back of the room, I hope are pretty clear.
All right.
Can we have one quick caucus?
Sure.
Thank you.
Recess? Recess till 11:15. right. So,
So I have Senator Bradley moved Amendment 0673S. I did not hear a second.
Second. Call me radar.
all right, are we ready to take the vote?
Yeah.
Okay, all those in favor of Amendment 0673S, say aye.
Aye.
Opposed?
No.
Aye.
Move out to pass as amended?
I'll second. All those in favor of ought to pass as amended on Senate Bill 36, say aye.
Aye.
Opposed?
No.
Okay. I will take that out.
Motion to move out of exec?
Just a reminder, I think we have 3 bills left.
3 Senate bills. We got House bills last night.
Oh, good.
Yeah.
Yeah, I got, energy's got a bunch of house bills. 6 house bills.
How
in
many?
energy.
5.
Okay. Well, at least for now, we've got 3 bills lined up for next week. All right, do I hear a motion to move out of exec?
Yes. Second.
All those in favor say aye.
Aye.
Opposed?